My name is Stephanie Glegg, and I'm studying how networks of people in our healthcare system impact the use of research in healthcare decision-making. And I'd like to acknowledge the support of my funders and affiliations, including the Public Scholars Initiative at the University of British Columbia. The biggest problem in healthcare today is that when new, high-quality research demonstrates that a treatment is effective, it takes 10 to 20 years for it to be adopted widely by healthcare providers. This means that many children miss out on the treatments that they need because they time out of the system before our health services can catch up. Another pressing example is the overdose crisis in BC. Over 900 people died last year, despite research telling us how to prevent those deaths. We don't have 10 to 20 years to affect policy change. This is a public health emergency, and people are dying every day. We need to find better ways to work together to save lives. So I'm involved in a research project where we're interviewing patients and families, community groups, frontline workers, health leaders, researchers, law enforcement, policymakers, and the media to learn more about how and when stakeholders interact about drug policy change so that we can make it more efficient. Every one of us deserves access to the safest, most effective healthcare treatments available, but because of this gap in what we know and what we do, up to 40% of patients fail to receive the best available care, and up to 20% receive ineffective or even harmful treatments. We can do better. We also invest millions of public tax dollars in health research every year. Much of this is wasted money if the research doesn't get taken up by the people who have the capacity to act on it. Suboptimal collaboration across research and healthcare sectors is one of the factors that slows research uptake. Most research that studies how best to move research into action focuses on raising awareness of the research, packaging it in different ways, or training healthcare providers in how to administer the treatments. These approaches can improve knowledge and skills, but they aren't very effective at changing behaviors. They also ignore the role that our social worlds play in changing our behaviors. My PhD research looks at how to build relationships among healthcare stakeholders, including researchers, healthcare providers, leaders, and policymakers, to improve research use. Because of the broad range of stakeholders involved, I'll be tailoring my findings into key messages and formats that will address each of their information needs. My dissertation will include a policy brief for government, an executive summary for health leaders, published articles for researchers, and infographics for other stakeholder groups. I'll be using an approach called social network analysis. This approach is concerned with the patterns of connections among people and the nature of those connections. I'm not talking about social media here. I'll be studying face-to-face interactions within groups of people in our healthcare system. We can use social network analysis to describe these networks in detail and to represent them visually. Then we can explain why the patterns we see are happening and understand how they influence an outcome, such as research use. For example, we might have well-connected subgroups that don't interact, hierarchical structures, or even isolated individuals that don't have access to information or resources. But what do we do when we find gaps in the network that hinder research use? We can still use support strategies that raise an awareness of the research, that improve knowledge, skills, or attitudes about the research and how to apply it, that facilitate research use, or that reinforce these behaviors. We just go about it in a different way. So we can identify champions within a subgroup to effect change there. We can target an entire subgroup that needs support. We can foster targeted interactions to promote collaboration and knowledge sharing. Or we can add or remove connections to improve the processes involved in research use. My research will study the networks of researchers, healthcare providers, leaders, and support personnel at 2 pediatric rehabilitation centers. I'll use an online survey to identify gaps or weaknesses in each center's network that we can target to improve the awareness and uptake of research. Then I'll conduct interviews to learn from different people in the networks about what works, what hinders research use, and what supports are still needed. Then I'll test the effectiveness of a network intervention designed to target these gaps. It might involve identifying key people who can connect subgroups, or finding new paths to enable network members better access to information or resources that will help them to integrate evidence. And all this is so that our children can benefit from the safest, most effective health innovations available. Thank you.